Bonjour tout le monde. Merci de vous joindre à nous ce matin. This morning we'll have the opportunity of hearing from Dr. Tam, who is Chief Public Health Officer of Canada, Dr. Njoo, who is Deputy Chief Public Health Officer of Canada, as well as Mary Ng, Deputy Minister Ng, who is Minister of Small Businesses, Export Promotion and International Trade. Dr. Tam.
Hello everyone, good afternoon, and bonjour à toutes et à tous. I will start with the latest numbers on COVID-19 in Canada. There are now 85,103 cases, including 6,453 deaths, and 44,219, or 52% of cases have now recovered. Labs across Canada have tested over 1,479,000 people for COVID-19 to date, with about 5% of these testing positive overall. In the past week, we've been testing an average of around 22,300 people daily. These numbers change quickly and are updated regularly on canada.ca/coronavirus. This week is Paramedic Services Week, and quite fittingly, this year's theme is Pandemic, Paramedics on the Front Line. I think most of us are aware of the vital importance of paramedics in our healthcare system as first responders, providing life-saving pre-hospital care during times of greatest urgency. This week is an opportunity to further recognize the breadth and depth of expertise of paramedical practitioners from dispatch to first response to hospital. This year in particular, we are recognizing the important role paramedics play on the front lines of the healthcare system during a crisis of the scale of COVID-19. It's impossible to overstate the life-saving importance of our paramedical services. Paramedics respond to all manner of emergencies, from attending the scene of an accident to providing life-saving care during acute health and mental health emergencies. Paramedics have also been instrumental on the front lines of the opioid crisis and now the COVID-19 crisis as well. Paramedics not only provide their expertise and one-on-one human connection, but they also forge working relationships with organizations to promote patient care and improve health in our communities. I recently learned of an innovative program that was spearheaded by paramedics in Renfrew County, a rural area just outside of Ottawa. It is a joint effort of partners across the health system to preserve healthcare system capacity, while at the same time ensuring that people receive the care they need. Through a virtual triage assessment center, patients can be linked with a healthcare provider and provided with an appointment. If an in-person appointment is required, a paramedic can be dispatched to make a house call. This is a wonderful example of the health system coming together to ensure that no one is left behind, and it highlights the important role that paramedics play in linking communities to healthcare settings. This is just one example of how paramedics contribute to health and well-being across the health system and in our communities in innovative ways. This week is a great opportunity to learn more and give an extra shout-out to paramedical service providers across Canada. Thank you. Merci.
Merci, Dr. Tam. Dr. Njoo.
Merci. Bonjour. Comme d'habitude, je commencerai par les derniers chiffres concernant la COVID-19 au Canada. Il y a maintenant 85 103 cas, dont 6 453 décès et 44 219 personnes, environ 52%, maintenant guéries. À ce jour, les laboratoires du Canada ont analysé les tests de dépistage pour la COVID-19 de plus de 1 479 000 personnes, dont environ 5% se sont révélés positifs. Nous testons actuellement une moyenne de 22 300 personnes par jour pour la dernière semaine. Ces chiffres changent rapidement et sont mis à jour régulièrement sur le site canada.ca/le-coronavirus. Cette semaine est la semaine des services paramédicaux et, à juste titre, le thème de cette semaine est « Pandémie, les ambulanciers paramédicaux en première ligne ». La plupart d'entre nous sont conscients de l'importance vitale des ambulanciers dans notre système de soins de santé en tant que premiers intervenants fournissant des soins pré-hospitaliers vitaux dans les moments les plus urgents. Cette semaine est l'occasion de reconnaître l'étendue de la profondeur de l'expertise des praticiens paramédicaux depuis la répartition, au premier secours et au transport à l'hôpital. Cette année en particulier, nous reconnaissons le rôle important que jouent les paramédicaux en première ligne du système de santé lors d'une crise de l'ampleur de la COVID-19. Il est impossible de surestimer l'importance de nos services paramédicaux. Le personnel paramédical répond à toutes sortes d'urgences, qu'il s'agisse de se rendre sur les lieux d'un accident ou de fournir des soins vitaux en cas d'urgence liés à la santé physique ou mentale. Les ambulanciers ont également joué un rôle essentiel en première ligne lors de la crise des opioïdes et maintenant avec la crise de la COVID-19. Ils apportent non seulement leur expertise et un lien humain direct, mais ils établissent aussi des relations de travail avec les organisations afin de promouvoir les soins aux patients et d'améliorer la santé dans nos collectivités. Il y a un programme novateur dirigé par les ambulanciers du comté de Renfrew, une zone rurale à l'ouest d'Ottawa. Il s'agit d'un effort conjoint des partenaires de l'ensemble des systèmes de santé visant à préserver la capacité du système de santé tout en veillant à ce que les personnes reçoivent les soins dont elles ont besoin. Grâce à un centre virtuel d'évaluation de triage, les patients peuvent être jumelés avec un prestataire de soins de santé et obtenir un rendez-vous. Si un rendez-vous en personne est nécessaire, un ambulancier paramédical pourrait être envoyé à domicile. Il s'agit là d'un magnifique exemple de collaboration entre les intervenants du système de santé pour que personne ne soit laissé pour compte, et cela met en évidence le rôle important que jouent les ambulanciers paramédicaux pour relier les collectivités aux établissements de soins de santé. Ce n'est là qu'un exemple de la manière dont le personnel paramédical contribue de manière novatrice à la santé et au bien-être dans l'ensemble du système de santé, de même que dans nos collectivités. Cette semaine est une excellente occasion d'en apprendre davantage sur les services paramédicaux et d'exprimer notre reconnaissance pour les services essentiels qu'ils fournissent partout au Canada. Merci.
Merci, Dr. Njoo. Mary?
Thank you so much, Jean-Yves. Good afternoon, everyone. Bonjour tout le monde. Over 8.5 million Canadians are employed by a small business across our country. To the entrepreneurs who run these businesses, you are the key to ensuring millions of Canadians can get back to work as we take the gradual steps towards restarting our economy. You're at the heart of our communities, and that is why we're here to support you. Right now, the smallest and the most vulnerable businesses are facing additional challenges when it comes to accessing tailored financial planning advice. Today, we are launching the Business Resilience Service in partnership with the Canadian Chamber of Commerce, a free hotline operated by 125 business advisors from the Chartered Professional Accountants of Canada. This service provides Canadian business owners, including people who run charities and not-for-profits, with customized financial guidance who wouldn't otherwise have access to it, from navigating tax regulations and government supports to planning their path to recovery. Again, this service is meant for vulnerable small businesses with pressing financial needs and business owners who may otherwise have difficulty accessing tailored financial advice. You can now call toll-free 1-866-989-1080. This is available 7 days a week for the next 4 weeks. Nous continuerons à veiller à ce que toutes les entreprises soient soutenues à chaque étape de cette crise. Which leads me to another business support launch. As you've heard, applications for the Canada Emergency Commercial Rent Assistance are now available via cmhc.ca. To help business owners as efficiently as possible, we are staggering the applications. Aujourd'hui, c'est ouvert aux propriétaires et jusqu'à 10 locataires dans le Canada Atlantique, en Colombie-Britannique, en Alberta et au Québec, et ouvert le jeudi pour ceux qui ont plus de 10 locataires. Tomorrow is open to landlords with up to 10 tenants in Manitoba, Saskatchewan, Ontario, and the Territories. And Wednesday is open to those with over 10 tenants. And then on Friday, it's open to all landlords across Canada. We expect the money to flow starting next week. While rent falls under provincial responsibility, we have stepped up to partner with provinces and territories to reduce rent by 75% for businesses who've experienced severe hardship. Through this program, if you're a small business owner or an entrepreneur, you will only have to pay 25% of your rent, while we cover 50% in forgivable loans to your landlord. If you're a landlord or a commercial property owner with a small business tenant eligible for this program, we're asking you to step up and to work with us and your tenant to apply. Given these extraordinary times that we are finding ourselves, your participation in the Canada Emergency Commercial Rent Assistance Program will help our businesses, our workers, and our economy. And this isn't just about doing the right thing. It is also making financial sense for you as a landlord. Because if your tenant declares bankruptcy and is evicted, you will lose all the steady stream of income you depend on, and you would face additional costs while you search for new tenants. You've all heard this before, but it remains true. We are all in this together. Et il est dans notre intérêt à tous de travailler ensemble pour que nous puissions tous nous en sortir. We'll keep working hard to support all Canadians as we begin to restart our economy. We've got your back every step along the way. We're going to keep doing this. Merci beaucoup. Thank you.
Merci beaucoup, Mary, d'avoir résumé deux importantes annonces de ce matin. Premièrement, l'annonce de l'aide d'urgence du Canada pour le loyer commercial. Les propriétaires de locaux commerciaux dans les provinces de l'Atlantique, du Québec, de l'Alberta et de la Colombie-Britannique peuvent dès ce matin, dès aujourd'hui, soumettre leur demande pour venir en aide à leurs locataires de petites entreprises qui travaillent dans des conditions extraordinairement difficiles. La deuxième bonne nouvelle, c'est les discussions qui vont avoir lieu, qui vont continuer d'avoir lieu, mais de manière encore plus intense avec les provinces et les territoires pour la fourniture de congés de maladie payés pour les travailleurs au cours des prochains mois. On sait que les prochains mois vont être des mois d'insécurité et que les travailleurs vont devoir tout faire ce qu'ils doivent faire pour protéger à la fois la santé, la santé de leur famille et aussi la santé de leurs collègues. Et ces congés de maladie payés vont maintenir aussi la capacité de ces travailleurs de travailler avec leurs employeurs pour faire en sorte qu'au cours des prochains mois, on n'ait pas à choisir entre protéger sa santé et payer l'épicerie. Donc, on félicite le gouvernement canadien, évidemment, mais aussi les gouvernements des provinces et tous les membres de la Chambre des communes qui ont affiché leur souhait de progresser sur cet enjeu. Alors, ceci étant dit, nous serions très heureux de répondre à vos questions.
Merci, Monsieur le Ministre. So, exceptionally today, we're going to start with the room to give a little more time to folks on the phone. Julie.
Alors, Mr. Duclos or Ms. Ng, please. I'm just wondering how you can explain to Canadians that you're allowing employees of the Liberal Party to tap into the wage subsidy, even though you fundraise millions of dollars every year. And municipalities, for example, who have had to lay off thousands of people, can't tap into it.
Well, thank you for the question. Now, the absolute priority of the government, and I think a priority shared by most Canadians, is to support those workers and those families that are struggling through the very difficult circumstances that we are living through in the last few weeks. And that's why workers need that support, whoever they may work for, whether it's a small business, a larger business, and that's why we believe that this support is absolutely essential. It's guided by the principles of focusing on people and helping everyone go through the crisis.
As I said, municipalities can't tap into it. Naheed Nenshi of Calgary said, I wish I could tap into that program. They're laying off thousands of people. Are you going to change it so they can, for example?
Well, your very important question on municipalities is absolutely relevant. As we all know, the federal government just a few days ago did announce, either through the Prime Minister or through the Deputy Prime Minister, a real will to work with provinces and territories to see how we can support the essential work of municipalities and cities. But that needs obviously to be done in collaboration and with the full support of provinces and territories.
So
Thank
not
you,
with a
Minister.
wage subsidy. Okay.
Ian?
Mr. Duclos and Ing, same question. I mean, how do you think it looks to Canadians to see political parties taking advantage of a wage subsidy program that you put forward?
Well, I would perhaps extend my earlier question, reminding everyone again that we are absolutely focused on workers and their families. We have had just a few weeks ago a Statistics Canada report saying that almost 6 million Canadians have either lost their job and all of their income or most of their income. So the circumstances are very difficult for workers and families, and that's why the emergency wage subsidies was put into place. Now that program, as all programs put into place in a relatively rapid time period, come with conditions and restrictions and obligations for transparency, and these obligations and restrictions apply to all businesses.
Right, but that's not what I asked you. I asked you, how do you think it looks to Canadians for political parties to accept the wage subsidy when, as my colleague pointed out, municipalities can't do that, and some companies are going under even with these programs in place. So how does it look to Canadians, do you think, a political party accepting a wage subsidy program that you put forward?
Well, I believe most Canadians know someone, either in their family or in their community or a friend that has lost his or her job in the last few weeks. And when we go through these difficult circumstances, we need to look after each other and support each other, whatever circumstances, in all cases, independently of the control of those particular workers, have led to the loss of that job and that income. So it's an absolute priority for this government to look after everyone and not to engage into discussions that might lead Canadians to feel less important than others. I think everyone is important in this particular crisis, and everyone needs to be supported according to rules and regulations that are transparent and apply to everyone.
Was the Liberal Party having to look at laying off staff without the wage subsidy?
I cannot speak for any particular organization. What I can do, however, is to speak for the vast majority of Canadians who understand that this crisis is very difficult for a large number of workers and families.
Thank you, Minister. Just a friendly reminder, that's one question, one follow-up. We'll now go to the phone. Operator?
Thank you. Merci. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, appuyez sur étoile 1. The first question is from Marie Vastel Le Devoir. La parole est à vous.
Oui, bonjour, Monsieur Duclos. J'aimerais vous poser une question pour ma part sur l'annonce d'aujourd'hui sur les congés maladie que vous entendez négocier avec les provinces. J'aimerais savoir ce qu'il en est du côté du fédéral en ce moment. Le Code canadien du travail prévoit seulement un minimum de 3 jours de congés maladie payés. Est-ce que le fédéral s'engage à changer lui aussi son Code canadien du travail pour assurer 10 jours de congés maladie à l'avenir?
C'est une excellente question et on peut tout à fait comprendre que la réponse est oui, que le gouvernement canadien va devoir évidemment travailler avec les entreprises sous sa juridiction, même si la plupart des employés sont sous juridiction provinciale. Il y a plus de 90% des travailleurs au Canada qui travaillent dans des conditions sous juridiction provinciale. Mais si on invite les provinces à travailler avec le gouvernement fédéral, bien, on invite aussi le gouvernement fédéral à faire son travail lui-même.
Est-ce que vous pouvez me dire si l'échéancier est le même que pour les provinces. Monsieur Trudeau parlait ce matin d'espérer d'en venir à une entente d'ici cet automne pour qu'il y ait des congés maladie offerts cet automne si les gens se sentent symptomatiques. Est-ce que l'objectif est le même au fédéral? Est-ce que vous allez changer le Code canadien du travail d'ici l'automne? Et Monsieur Trudeau a aussi dit que plusieurs provinces sont d'accord avec cette idée d'offrir 10 jours de congés maladie garantis. Pouvez-vous me dire qu'en est-il du Québec?
Bon, deux questions séparées. Dans les deux contextes, que ce soit pour les travailleurs sous juridiction provinciale ou les travailleurs sous juridiction fédérale, il y a évidemment des étapes extraordinairement importantes à franchir. Le fédéral doit faire son travail correctement avec les syndicats, avec les entreprises qui travaillent dans des conditions sous juridiction fédérale. Donc, ce travail va se faire en mode accéléré, mais quand même en mode respectueux de la contribution importante de ses partenaires. En ce qui a trait aux provinces, bien, c'est aux provinces, je pense, de répondre à cette question importante. Mais ce qu'on entend partout au Canada, c'est la reconnaissance que les prochains mois vont être cruciaux, parce que les situations dans lesquelles les travailleurs se retrouvent parfois, où ils ont besoin de choisir entre protéger leur santé et s'assurer de pouvoir joindre les deux bouts. Ces situations vont devoir être évitées le plus possible. En économie, on appelle ça des externalités négatives. Lorsqu'un travailleur prend une mauvaise décision de retourner, de travailler, même s'il pense peut-être avoir des symptômes de la COVID-19, bien, ça met non seulement en jeu sa propre santé, mais aussi la santé de ses collègues. Donc, ça nuit aussi à la capacité de son entreprise de poursuivre ses travaux. C'est pour ça qu'on est convaincu qu'on va pouvoir procéder assez rapidement, mais évidemment, on doit faire le travail correctement.
Merci, Monsieur le ministre. Opérateur, prochaine question, s'il vous plaît.
Merci. Thank you. The next question is from Stephanie Levitt from the Canadian Press. Please go ahead. Your line is now open.
Good morning, or good afternoon, I guess. Thank you for taking the question. It's for Dr. Tam. The point, all along here of shutting down the economy, getting people to stay home and flatten this curve was to buy time for the healthcare system to get ready. And I just wonder what your assessment is of how ready the system actually is, should there be a second wave. And I know there's provincial and local differences here, but just broadly speaking, what do you think? Is the healthcare system ready?
So I think we do have to prepare for potential for another wave. And I mean, we always should prepare for the fact that the second wave could even be worse than the first wave. So that's a very important question. So we know that with the collective efforts, we did not exceed the health system capacity to cope with this initial wave, this first wave. So that's obviously been a tremendous amount of work to do that. But we got to keep going to increase capacity. I know that we haven't exceeded our ICU capacity, but I think provinces are continuing to ramp up, including ventilators and other supplies. But also, of course, as everybody knows, keep going on the ramping up of personal protective equipment. That's very important, should we get more patients as well. And also, generally, I would say, having learned perhaps how people have capitalized on virtual care, etc., keep going at some of those efforts that have worked, because some of those similar approaches should be continued so that you leave enough health system capacity. Of course, one of the key features of the current pandemic is the long-term care homes and seniors. So I do think that there's more work to be done in that area. Some of the long-term care homes or senior living areas haven't as yet completely extinguished their outbreaks. So that also tells us that we have to just keep going with those capacities, as well as the capacities for infection prevention control in some of these higher risk settings, including shelters and in correctional facilities. But I think you can never be overly prepared, and that we need to just keep going with some of these capacity developments. And that goes along with lab testing as well. We're continuing to procure and including ramping up domestic capacity for some of our laboratory requirements.
Follow-up?
Yeah, thank you. My follow-up is for Minister Duclos, and I wanted to ask you about accountability and transparency during COVID-19 and the report out today that's recommending more of it, frankly. Why aren't ministries releasing more information proactively? There's a lot of delays with access to information requests. What steps are you taking to really make sure Canadians are getting a full picture of what's going on with government at the moment?
Well, what you say is absolutely correct. In particular, in the context of this crisis, we need transparency and openness. Canadians need information, and I would signal that you journalists are important players, important actors in making Canadians feel informed and reassured in many instances. And that's what public servants have been trying to do for the last few weeks. Now, we understand that it's not easy. It's certainly not easier for public servants to provide that level of information in the current context where they face professional and personal challenges. But I've reminded my colleagues and the Secretariat, the Treasury Board Secretariat is supportive of other departments in making sure that whatever is possible is done in the current context. What I would also add is that with the Information Commissioner, I've had exchanges looking forward, making sure that we can what we can do is, for instance, more proactive divulgation, dissemination of information, being more proactive as opposed to being reactive, and also a strong focus on technology. We are learning in this crisis the importance and the usefulness of technology and how it can perhaps lead to better ways of doing things in the future.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. La prochaine question est de Émilie Bergeron de l'agence QMI. La parole est à vous.
Oui, bonjour. J'aurais une question sur l'aide d'urgence pour les loyers. Donc, depuis que le portail est ouvert à 8 heures ce matin, combien de demandes ont été reçues jusqu'à présent?
Well, thank you for the question. As I stated earlier, we are opening up the portal in phases to a certain number of provinces today and tomorrow, with landlords that have more than 10 tenants, and then open to everyone on Friday. We are going to monitor the take-up of this, and as I said as well, the importance and the focus of this Canadian commercial rent assistance is to help our small businesses that have been hardest hit during this time so that they can manage through this period and get on that road to recovery and restart.
Émilie, en suivi?
Oui, merci. Ma deuxième question, ça serait pour M. Duclos sur l'utilisation de la subvention salariale par le Parti libéral. C'est sûr que on comprend votre ligne que vous voulez aider les travailleurs, peu importe pour qui ils travaillent, mais pour les Canadiens qui pensent au coffre quand même assez bien garni du PLC, mais aussi du Parti conservateur, même si les dons ont chuté dernièrement, quel message ça envoie alors qu'il y a d'autres entreprises qui ont vraiment de la difficulté à joindre les deux bouts, à payer leurs employés, qu'un parti traditionnel qui a quand même beaucoup d'argent dans ses fonds publics en général, dans ses coffres, ait à recourir à cette aide-là, pendant que d'autres ont de la difficulté à y avoir accès. Quel message ça envoie?
Bien, merci pour la question. Le message principal qu'on envoie depuis le début de la crise, c'est d'être en appui aux travailleurs. Et la subvention salariale est conçue exactement pour ça. Il y a des critères non seulement très solides, mais aussi très clairs qui assurent que cette subvention salariale est versée pour les travailleurs. Et si une entreprise, quelle qu'elle soit, s'avérait à verser cette aide pour autre chose que pour les salaires des employés, bien, il y aurait des pénalités extraordinairement importantes. Dans le cas de la subvention salariale, c'est 225 %. Donc, cette aide doit être versée aux travailleurs. Les travailleurs canadiens et les familles vivent des conditions extraordinairement difficiles dans des millions de cas. Et c'est pour ça que cette aide est conçue pour aider ces travailleurs. Et on s'assure aussi en même temps que, comme je disais, les règles soient respectées par toutes les entreprises, quelles qu'elles soient.
Merci, Monsieur le Ministre. I'll turn back to the room again. Julie, I believe you had additional questions.
C'est pour Monsieur Duclos, s'il vous plaît. Just wondering if you could clear this up in terms of, this is about the disaster that continues to be underway in long-term care homes, and specifically about Rivera, which is one of the biggest chains in the country. So I'm just wondering, I believe it is still under the Public Sector Investment Board, which reports to you, right? For Treasury Board, the Public Sector Investment Board. So I'm wondering, have you had direct talks with Rivera about improving its conditions, considering that it's got a massive lawsuit against it and all the deaths from COVID?
Thank you. Well, there are two things. One, which I cannot comment on, which is the particular circumstances and details of a lawsuit or a class action. That would be, of course, inappropriate for a minister to comment on. What I can say, however, is that, and as you all know as well, and which is very important, is that we are extremely saddened by the difficult circumstance in which many of our seniors have been going through in the last few weeks. We know that this requires a level of leadership which is in strong support of the absolutely important responsibility and jurisdiction of provinces and territories. So although we are mindful of the fact that the federal government needs to be working respectfully, we have signaled a number of times that we want to do whatever we can to support the work of provinces and territories in managing the health sector.
The Public Sector Investment Board reports to Parliament, reports to you every year. Are you going to be more diligent about what's going on in these homes, regardless of the lawsuit?
Well, I think we will be certainly more mindful of the importance of protecting our seniors, and we will use all the tools that are appropriate for the federal government to do that.
Thank you, Minister. Ceci met fin à la conférence de presse pour aujourd'hui. That's it for today. Thank you, everyone.